And while we're on the topic of drug crisis, last week the Portland Fire Bureau announced a new pilot program for an overdose response team to help those struggling with addiction. Officials told us the hope is that it also takes some of the strain off the fire crews, so a full fire crew does not have to respond to every OD call. Last year they averaged 19 overdose calls per day across the city of Portland. So why are we telling you about that overdose response team again? Well, the city just released an audit of the Fire Bureau's community health programs, and that OD response team is part of it. And there are some interesting red flags and some political finger pointing that we think are worth highlighting. Here's the audit that you can find on the city's website. Portland Fire and Rescue Community Health Division programs need guidance and leadership to provide Portlanders with the services they need and reduce demands on firefighters. That's the title of the whole thing. Now, before we get too far into this, the field work for this particular audit ended in May of last year. The Fire Bureau says since then, some things have changed in regards to the Community Health Division, changed in a big way. Namely, it's been eliminated and absorbed by the Bureau's Medical Services and Training Division. So here's a chart to help you visualize that change. The green programs, Portland Street Response and Community Health Access and Treat, or CHAT, which is the overdose response team that's part of that, all those moved to Medical Services and Training. And the Community Connect program is gone, disappeared, no more. The purpose of the audit was to figure out if the Fire Bureau was using programs like Portland Street Response and CHAT to reduce the workload for fire crews, which are often stretched thin responding to these lower acuity calls, as they call them, lesser emergencies. An example would be someone calling 911 because they feel sick and they do not know how else to get health care. In fact, according to the audit, the Fire Bureau responds to more medical calls than fire calls. In the past 3 years, the Fire Bureau has averaged around 86,000 incidents per year, and well over half of those, 63%, were medical related. Some of the medical calls are indeed true emergencies, but some of them definitely not. This graph shows the latest data that tracks those 911 calls that are considered non-emergency. In 2020 to 2021, almost 1 in every 3 calls for service ended up being non-emergency. And getting a full fire crew of 4 people and often a big old fire truck to those scenes is both time-consuming, expensive, and also takes crews away from the true emergencies. Let's get into some of the big issues the audit found. First, the Fire Bureau did not establish clear goals for Community Health Division and had no plan to meet goals because, well, they didn't exist. The Bureau did not measure performance equally between Portland Street Response and CHAT, basically using different yardsticks to measure the success. And overall, did not measure whether the programs eased the workload of the firefighters. And finally, the Bureau's, quote, inconsistent commitment to Community Health Division magnified shortcomings and contributed to an uncertain future. And as with any audit, there's a list of recommendations to try to solve some of those big issues. First, the auditors say fire should clarify to Bureau employees and the public how committed the Fire Bureau is to operating Portland Street Response and CHAT. If the Bureau does not want to be involved with Street Response or CHAT, then allow City Council to find the right fit. Next, set clear goals. Then, create a plan to meet those goals. Makes sense. Measure the progress towards the outcomes and develop a process to be able to continuously review that progress to make adjustments if needed. All right, that all seems really pretty self-explanatory, right? And if you've lived in Portland for more than 6 months, you probably know it's never that easy. Remember the purpose of the audit? To determine if Portland Street Response and CHAT crews were helping reduce the workloads of those fire crews? Well, according to Portland Fire Chief Ryan Gillespie, that was never and is not now a goal for either program at all. Yeah, we agree this got kind of weird pretty fast. Auditors say that documents that they reviewed showed the programs indeed had a goal of being patient-centered and reducing the low acuity calls for firefighters. So reducing that workload. Gillespie says, nope, absolutely not. In a 5-page response to the audit, Gillespie says the goal of Portland Street Response is to respond to behavioral incidents, while the CHAT crews are responsible for medical calls. Gillespie puts the onus on Portland Street Response on the Police Bureau, claiming that 98.5% of Portland Street Response responses are for calls that would normally go to police, not fire. And he's not shy in saying that the City Council is the entity that needs to make decisions for street response, writing, We are looking for City Council's guidance regarding goal refinement for PSR, as this was a program established at the council level. Basically saying, this is not my thing, not my problem. As you will likely remember, the person who brought the street response to life was former Commissioner Joanne Hardesty, who did not want the Police Bureau to be involved with that. That's why it got put under the Fire Bureau. It seems to us, at least, that Gillespie thinks the program would be better served somewhere other than the Fire Bureau. The only nugget in your response that shows otherwise is that the Bureau has hired a community health policy analyst to develop policy and funding plan for street response. Chat, on the other hand, was created by Portland Fire and Rescue in partnership with Care Oregon. But as far as Chat being used to reduce workloads for his fire crews, Gillespie wrote, a common denominator between PSR and Chat is that neither program was designed to reduce firefighter workload. While Chat does provide frontline crews with some relief from lower acuity medical calls, this is an added benefit of our relationship with Care Oregon, not a Chat program goal or performance metric of our agreement. So yeah, not a goal, he says, but a benefit on the side. So the audit that took city workers months to complete, well, seems a little useless, at least from the perspective of the fire chief. Many of you may be wondering how Commissioner Rene Gonzalez feels about all this, since he now oversees that Fire Bureau. In his own response to the audit, Gonzalez writes, the need to ensure these programs are structurally sound, grounded in articulatable, actionable goals, and financially cost-effective can no longer be ignored. I'm committed to these programs' long-term success and have full confidence in both Bureau and program leadership to guide us there. Your audit serves as an important reminder that sometimes we need to slow down to speed up. So Gonzalez is committed to the long-term success of Portland Street Response, while his own fire chief seems like he can't wait to make it someone else's responsibility. That's our take on it, at least. We would love to hear your thoughts. Remember, the audit and responses from Gillespie and Gonzalez are available now on the city's website. Give it a look. Let us know if you think we're full of it. We don't think we are. Email the story at kgw.com or call and leave a voicemail, 503-226-5090.